Hello friends. Today we are going to discuss about World Bipolar Day. I am Dr. Suresh Badadmat, Professor of Psychiatry working at NIMANS, Bangalore. Today we are going to discuss about World Bipolar Day, which is celebrated every year on 30th March. 30th March is Vincent Van Gogh's birthday. He is a Dutch artist and he was diagnosed to be suffering from bipolar disorder posthumously. The reason being is his painting depicted his mood symptoms. He created more than 2,100 artworks, but unfortunately at the age of 37, he committed suicide. That is, he died because of suicide. Bipolar disorder is also called as bipolar affective disorder. It is also called as manic depressive psychosis. Bipolar disorder is a group of brain disorder that cause extreme fluctuation in a person's mood, energy, and ability to function. World Bipolar Day is celebrated to raise awareness, to remove stigma, and improve help-seeking behavior in patients with bipolar disorder and family members to accept them and support them in taking treatment. The prevalence of bipolar disorder in India is 0.3%. That is, a report by National Mental Health Survey which was done in 2015 and 2016. Unfortunately, the report also said that 70% of the persons who have been diagnosed as bipolar disorder are not on treatment. That means if 0.3% of 140 crore means 40 to 45 lakh people are suffering from bipolar disorder in India, and 70% are not on treatment. It means 32 lakhs people are suffering from bipolar disorder. It is not just 32 lakhs, it is 32 families are suffering from bipolar disorder. A person, he himself is not suffering, the whole family suffers because of bipolar disorder illness. The challenges in diagnosis of bipolar disorder is basically there are no lab tests like blood test, urine test, sputum test which positively diagnoses bipolar disorder, or there are no investigations such as imaging, CT scan, MRI which positively diagnoses bipolar disorder. Bipolar disorder diagnosis is done by clinical examination by a psychiatrist, by history, mental status examination and observation. Let's understand the concept of bipolar disorder. If you look at the x-axis, it can be considered there the normal mood, and the above is the happiness and below is considered as sadness. Invariably, every person has ups and downs within a normal limit, so-called every day. Every person has a good day and a bad day. But in a person with bipolar disorder, they will have severe depressive symptoms, that is severe sadness in terms of quality and quantity. Similarly, they will have severe happiness to that extent they become extremely disruptive and violent. And if the depression is for more than 2 weeks, it is called as depressive episode. And if the happiness, that is mania, if it is there more than 1 week, we call it as manic episode. So if a patient has both of them, we call it as bipolar disorder. And even one episode of mania is also considered as bipolar disorder. There are 3 different types of bipolar disorder: bipolar 1, bipolar 2, and cyclothymic disorder. Bipolar 1 disorder is a classical depression and mania. Bipolar disorder 2 is a depression will be there, along with the patient will have hypomanic symptoms. Hypomanic means the mania is very less severe. Cyclothymic disorder is a person, in this diagnosis, the person will be suffering with sadness of mood, fluctuating with happiness mood. These fluctuations will come in their way of functioning on day-to-day basis. Hence, cyclothymia, if it is there for more than 2 years without being normal of at least for 2 months, is considered as cyclothymia. The comorbidity is the rule in bipolar disorder. If you diagnose anybody having bipolar disorder, invariably 40 to 60% of them will have one or the other psychiatric diagnosis, such as 40% of them will have substance use like alcohol, maybe other drug use. Anxiety disorder is there in 50 to 60%. OCD 10 to 15%. Attention deficit hyperactive disorder is 20 to 30%. Personality disorder 30%. Suicidal attempt and also death by suicide is 10 to 20%. Untreated bipolar is very common. As we have mentioned, 70% of them not on treatment. Invariably, 10 to 20% of them cause suicide. That means death by suicide is common. Unfortunate. So hence the treatment is required. If they don't take treatment, invariably they end up taking drugs or alcohol. Sometimes high-risk sexual behavior ending up with HIV or other sexually transmitted diseases. Disruption in family and divorce is very common. Impact on children is very difficult to measure. And also finance loss, job loss, becoming unemployed is very common in bipolar disorder diagnosis. Violence, conflict with law is another biggest problem. Stigma, isolation, going into depression, again one of the commonest. Many a time, the family members become very difficult to manage them and they throw them out of the house. They become destitute, homeless. So these are the complications of untreated bipolar disorder. So what are the different treatment options? Medications, electroconvulsive therapy, psychoeducation, talk therapy. So the combination of treatment is required many a time. The course of bipolar disorder, you should need to understand it has a chronic course. Research have clearly said that usually the bipolar disorder remits on its own by 6 to 9 months. But in this 6 to 9 months, it will create a lot of complication. And by treatment, these episodes can be shortened. But unfortunately, relapse is the default. That means relapse is very common. 30 to 40% relapse within 1 year. 55 to 60% relapse in 2 years. 75% by the end of 5 years. My dear friends, that means relapse is by default. To conclude, bipolar disorders patients on medication, they do very well. It's an episodic illness. Unfortunately, taking medication, that is adherence, is the biggest challenge in persons with bipolar disorder. Hence, relapse is by default and comorbidity is the rule. To remain away from the episodes, they need to be on medication, having a good sleep hygiene, being abstinent from alcohol and other substance, and having a good family support will prevent relapses. Please remember, bipolar disorder is treatable. Thank you very much for giving your valuable time. Stay safe.